For 20 years, Dorothy Mitchell was known as the Angel of Mercy at Sunset Manor Nursing Home. Families trusted her to care for their elderly loved ones in their final days. What they didn't know was that Dorothy was deciding when those final days would come. She murdered over 400 elderly patients with morphine overdoses. Welcome back to Crime Secrets, where we expose the predators who exploit our most vulnerable populations. Today's case isn't just about a serial killer. It's about how one woman used society's trust in healthcare workers to commit what may be the largest elderly care murder spree in American history. This is the story of Dorothy Mitchell, the nurse who turned mercy into murder, and the nursing home system that enabled her to kill for 2 decades. What you're about to hear will make every family question who they trust with their aging parents. Dorothy Ann Mitchell was born in 1952 in rural Tennessee, the youngest of 5 children in a deeply religious Baptist family. Her childhood was marked by frequent visits to care for her ailing grandmother, experiences that she later claimed sparked her interest in nursing. Dorothy's family remembered her as unusually comfortable around illness and death, often volunteering to sit with sick relatives when other family members found it too difficult. After graduating high school in 1970, Dorothy enrolled in the nursing program at Nashville Community College. Her instructors noted that she excelled in pharmacology and pain management, showing particular interest in morphine administration and end-of-life care. She graduated in 1973 with honors and immediately began working at various hospitals throughout Tennessee and Kentucky. However, Dorothy's early career was marked by unusual patterns that should have raised red flags. At 3 different hospitals between 1973 and 1985, Dorothy worked on wards that experienced higher than average patient mortality rates during her shifts. When questioned, Dorothy would explain these deaths as expected outcomes for critically ill patients, often emphasizing how peaceful their final moments had been. In 1985, Dorothy made a career change that would provide her with the perfect hunting ground. She accepted a position at Sunset Manor Nursing Home in suburban Nashville, a 200-bed facility that catered to elderly patients requiring long-term care. The nursing home was understaffed, underfunded, and desperate for experienced nurses who could handle the demanding work of caring for dying patients. Sunset Manor was exactly what Dorothy had been looking for, a place where death was expected, families were emotionally vulnerable, and oversight was minimal. The facility's administration was focused on maintaining their Medicare certification and keeping costs low, which meant that detailed reviews of patient deaths were rare. Dorothy quickly established herself as the nursing home's most dedicated employee. She volunteered for overtime shifts, worked holidays, and seemed genuinely committed to providing comfort to dying patients. Her colleagues appreciated having someone willing to handle the most difficult cases, and families were grateful for her gentle bedside manner during their loved ones' final days. What no one realized was that Dorothy had developed a twisted philosophy about elderly care. She believed that prolonged suffering was cruel, and that she was performing a merciful service by helping patients transition to death more quickly. In her warped mind, she wasn't committing murder. She was providing compassionate end-of-life care. Dorothy's method was simple and virtually undetectable. She would identify patients who were suffering from chronic pain, dementia, or terminal illnesses. During her night shifts, when staffing was minimal and families were rarely present, she would administer lethal doses of morphine through patients' IV lines or feeding tubes. Dorothy had perfected her killing technique over years of practice. She understood that elderly patients in nursing homes often had complex medical conditions that could explain sudden deaths. By using morphine, a drug commonly prescribed for pain management in elderly patients, she could cause respiratory depression that would appear to be a natural complication of the patient's existing conditions. Her selection process was methodical. Dorothy targeted patients who had minimal family involvement, those whose deaths would not surprise medical staff, and individuals who had expressed wishes to not suffer. She kept informal notes about which patients were ready and which families would be most accepting of a sudden but peaceful death. The genius of Dorothy's approach was how she positioned herself as the bearer of comfort rather than death. When families arrived to find their loved one had died during the night, Dorothy would be there to console them, explaining how their relative had passed peacefully without pain. She would describe holding their hand during their final moments, providing the kind of closure that grieving families desperately needed. Dorothy also understood the importance of timing. She would space out deaths to avoid suspicion, ensuring that no more than 2 or 3 patients died during any given month on her shifts. When mortality rates did spike, she would volunteer explanations about flu outbreaks or particularly sick admissions that made deaths more likely. Perhaps the most disturbing aspect of Dorothy's crimes was how she manipulated grieving families. She had perfected the art of providing exactly the kind of comfort that families needed while hiding her role in causing their grief. Dorothy would often initiate conversations with families about their loved ones' suffering, subtly planting seeds about whether prolonged care was truly humane. She would make comments like, "I've seen so many patients struggle unnecessarily," or, "Sometimes the kindest thing is to let them go peacefully." These conversations served a dual purpose. They prepared families to accept sudden deaths and provided Dorothy with psychological justification for her actions. When patients died, Dorothy's performance was flawless. She would call families in the early morning hours, her voice heavy with emotion, explaining that their loved one had passed during the night. She would emphasize how peaceful the death had been, how the patient hadn't suffered, and how honored she felt to have been present during their final moments. Families were so grateful for Dorothy's compassion that many sent thank you cards, flowers, and even monetary gifts. Some families specifically requested that Dorothy care for other relatives who were admitted to Sunset Manor. Dorothy had turned mass murder into a reputation for exceptional patient care. Despite Dorothy's careful planning, there were warning signs that should have triggered an investigation years earlier. Between 1985 and 2005, Sunset Manor's mortality rate was significantly higher than comparable facilities, particularly during Dorothy's shifts. More specifically, deaths in Dorothy's wing occurred at nearly twice the rate of other areas of the nursing home. In 1998, Dr. James Patterson, a consulting physician who made regular rounds at Sunset Manor, noticed unusual patterns in patient deaths. Many of Dorothy's patients died shortly after being prescribed increased pain medication, often just hours after their conditions had seemed stable. Dr. Patterson raised concerns with the nursing home administration, but his concerns were dismissed as the normal variations expected in elderly care. The first formal complaint came in 2003, when the family of 78-year-old Margaret Chen questioned the circumstances of her death. Margaret had been recovering well from hip surgery and was expected to return home within weeks. When she died suddenly of what was listed as respiratory complications, her son demanded an investigation. However, the attending physician found nothing suspicious in Margaret's medical records, and the matter was dropped. Another red flag emerged in 2004 when the pharmacy supplying Sunset Manor noticed that morphine consumption had increased dramatically over the previous 5 years. The increase coincided exactly with Dorothy's tenure at the facility, but administrators attributed it to an aging patient population with greater pain management needs. Dorothy's downfall began in 2005 when Sarah Williams, a new nursing supervisor, was hired at Sunset Manor. Sarah had previously worked at a major hospital and was immediately struck by the facility's high mortality rate and the unusual concentration of deaths during night shifts. Sarah began conducting her own analysis of patient deaths and discovered that mortality rates during Dorothy's shifts were 340% higher than during other nurses' rotations. More disturbing was the pattern of deaths occurring within hours of morphine administration, often in patients whose conditions hadn't been considered terminal. When Sarah approached the nursing home administration with her findings, she was initially dismissed and told that Dorothy was simply assigned to the most critical patients. However, Sarah persisted and eventually contacted the Tennessee Department of Health, which launched a formal investigation in late 2005. The investigation revealed a horrifying pattern spanning 20 years. Medical examiners reviewed autopsy reports from dozens of Sunset Manor deaths and found evidence of morphine toxicity levels that were inconsistent with prescribed dosages. Computer records showed that Dorothy had accessed the medication dispensary far more frequently than other nurses, often during times when no medications were scheduled to be administered. Dorothy Mitchell was arrested on March 8, 2006, at her home in Nashville. When confronted with the evidence, Dorothy initially maintained her innocence, insisting that she had only provided compassionate care to suffering patients. However, as investigators presented detailed records of morphine discrepancies and patient death patterns, Dorothy's defense began to crumble. During a 12-hour interrogation, Dorothy finally confessed to what investigators called the most extensive elderly care murder spree in American history. She admitted to killing over 400 patients between 1985 and 2005, using morphine overdoses to end their suffering. Dorothy showed no remorse during her confession, instead expressing pride in what she saw as her merciful service to the elderly. Dorothy's detailed confession revealed the true scope of her crimes. She had kept informal records of her victims, noting their names, dates of death, and her rationale for helping them die. Some patients had been killed simply because Dorothy found them annoying or demanding. Others died because Dorothy wanted to free up beds for new admissions. Dorothy Mitchell pleaded guilty to 48 counts of first-degree murder, representing cases where prosecutors had the strongest evidence, and was sentenced to life in prison without the possibility of parole. However, investigators believe the actual number of her victims exceeds 400, making her potentially the most prolific serial killer in American history. The Dorothy Mitchell case led to sweeping reforms in nursing home oversight, including mandatory mortality reviews, enhanced medication tracking systems, and increased supervision of night shifts. Sunset Manor was closed permanently, and several administrators faced criminal charges for negligent oversight. The Dorothy Mitchell case exposed a terrifying vulnerability in our elder care system. For 20 years, families trusted her with their most vulnerable loved ones, believing they were providing comfort and dignity in their final days. Instead, Dorothy was systematically murdering the people she had sworn to protect. Over 400 families believed their loved ones had died peacefully under Dorothy's care. The knowledge that these deaths were actually murders has left lasting trauma that may never heal. Dorothy's crimes remind us that sometimes the people we trust most with our vulnerable family members are the ones who pose the greatest danger. If this case horrified you as much as it horrified us, please subscribe to Crime Secrets for more investigations into institutional corruption and the predators who exploit the most vulnerable among us.